Bill Wagner is one of the more than 2 million Americans affected by atrial fibrillation, an abnormal heartbeat that can cause heart failure and stroke, sometimes resulting in death. In Bill's case, the medications used to control his atrial fibrillation weren't working, and he needed electrical shocks to jolt him back into rhythm more than a dozen times over the years.
It was like having a ticking time bomb in your chest.
Bill's history made him a candidate for a new procedure called Macroize surgery, being performed at Grant Medical Center in Columbus, Ohio by Dr. Thomas Solomon. The procedure involves making small incisions in the chest area. Then, with the help of a tiny camera, a microwave probe is used to burn small scars into the heart. These scars disrupt the faulty electrical impulses that cause the irregular heartbeat. The minimally invasive procedure results in a quicker recovery than the traditional open heart maze surgery, which requires a 10 to 12-inch incision in the chest and recovery that can take 3 to 6 months. With Macroize surgery, patients are out of the hospital in 3 to 5 days and fully recovered in 2 to 4 weeks.
The bottom line is smaller incisions usually translate into less pain, shorter recovery, less time off from work.
Long-term results have been very positive, with most patients showing no sign of atrial fibrillation a year after the procedure.
In most patients, the Macroize surgery restores sinus rhythm and keeps the patient in the normal rhythm without medication.
One of the other benefits of the surgery is that they also eliminate the left atrial appendage. And 80% of the strokes that do occur in these patients with atrial fibrillation actually occur from the left atrial appendage.
4 months after the procedure, Bill's heart is still in regular rhythm, and he feels like a new man.
I feel younger now and stronger than I have in 15, 20 years. But I have hopes now of living many years and enjoying many years with my family and my friends.
For Bill and others like him, Macroize surgery might mean an end to atrial fibrillation.